part of the knee. So I milk it up the inside, I press down on the outside, and look for fluid movement. Because the ballot mode test is not so sensitive unless there's a lot of fluid already. But this knee looks puffy, this one is not bad. But you don't have pain in the knee. No, so she's not aware of it. She doesn't have pain yet unless I do this and then she has pain. You don't have pain on this side. So the telltale signs, as I said, is popliteal spasm, gastro pain, lateral malleolar pain, and sensitivity of the tensor fasciolata, and sometimes sensitivity of the VMO. The mobilization is as follows. Just rotary mobilize. Can you scoot up a little bit that way? Okay. Oh, okay. Yeah. Good. Ankle is held by the outer hand. The inner hand holds the arch. I traction. I mobilize the foot in the midfoot. The midfoot is mobilized, and the tibiofibular joint on the femur is mobilized and flexed in stepping forward function. So we go back. That's good. That's better. Sometimes popliteus takes a while to relax. That's better. That's better. That's better. Yes. So that is, and then the swelling should go away. And I use internal rotation of the tibia to reinforce the mobilization. She holds her foot still. I try to pull up the forefoot and she resists me. So I try to invert the forefoot or supinate the forefoot and don't let me twist my finger. I try to push it down and dorsiflex the ankle. So she dorsiflexes the ankle against plantar flexion. I try to turn out the tibia and she holds it there. And then I push in the femur and she must externally rotate the femur. Yeah, it's like rubbing your belly and the top of your head. Don't let me push in and don't let me move the foot. So I'll repeat that. She's doing forefoot pronation, dorsiflexion, internal rotation, but external rotation of the hip. And that is what I pull. So I just tell her not to let me pull her big toe up. So she pronates. Don't let me push your ankle down. So she dorsiflexes. Don't let me rotate your foot out. So she internally rotates the tibia on the femur. And then she abducts the femur on the hip. And that is the synergy of correction for torque in the knee and relax. Okay, good. This is better now. Yes. Okay. Yes. Okay. So that's it. So okay. So more stabilization here, stretching of the hip flexors, re-education of kneeling position, because that will be our fundamental movement audit. Yes, can she kneel and be relaxed in this position? So we can use the plank, for example, 6-month plank to neutralize the pelvis, but we have to be careful that she doesn't use this strategy. So we have first to maybe have her brace in quadruped, and when we have a good canister without creasing, we move her into the plank, so that she's not fighting to be in the plank and substituting. So we find an undifferentiated position where we can monitor everything. She can relax her belly, she can breathe into here, and then we move her into the plank. And from the plank, we slowly get her into kneeling vertical. Yes. So that way she can adjust, and at the same time we do all the hip flexion stretching and fascia release of the anterior part of the fascia lata into the thigh, so that this will open. Because sometimes the fascia itself is what is tight, not the hip flexor, but it looks like a hip flexor shortening. So everybody's busy digging into the psoas, but it's not where the problem lies. So that is what I would do, but the objective signs are better post